All right. I'm ready for the answer. What is different about our response to this virus versus the ones you cite? Or
It's
why
us.
the difference?
It's us. It's the reaction. And I think a few things have been going on here. One is they've been working on this. By they, I mean the public health people, the media. They've been working on this since AIDS, which was the first epidemic. That's where I kind of ground my teeth, beginning in 1987. I wrote a book on it. I wrote countless articles. You may recall we were told the disease of them is suddenly the disease of us. AIDS doesn't discriminate. On and on and on, and it was all fake. AIDS was always a disease of gay men, intravenous drug users, and originally recipients of blood and blood products. It was always that way. It remains that way in the United States today. These people lied. I mean, there's no polite way of saying it. They lied because they thought they were doing, the Lord's work. They decided that to the extent that AIDS was seen as a disease of undesirables, it wouldn't get the kind of attention and money it deserved. And I will grant them this. They were incredibly successful. To this day, AIDS is the second biggest line item in the National Institutes of Health research budget. My point was the bad guys, as I call them, they don't see themselves as bad guys, but they were liars, and they intentionally lied, and they got away with it. They got away with it beyond their wildest dreams.
The ends justified the means in their mind, though, because they didn't want this to be a stigmatized community, the gays, et cetera. And so they said, let's pretend like this affects everyone equally. I totally agree with you, and I've always thought that, and you've proven it with your book. So, okay, keep going.
But it's not just the idea. It's the people themselves. Because two of the biggest culprits, perhaps you've heard their names, were Anthony Fauci and Robert Redfield. If you look at my book, my 1990 book, Redfield is on 24 different pages of my book. Fauci is on rather fewer pages. But Fauci actually kicked off basically the hysteria with a paper that he solely authored in 1983 saying it looked like AIDS could be spread through basically like the flu. It could be spread within a family. He published that paper in 1983. The very next year, he was appointed to his current position at the National Institute of Allergies and Infectious Diseases. That was his reward for being spectacularly wrong, but wrong in the right direction. He was alarmingly wrong. Redfield was wrong basically just across the board, including co-authoring a paper that said your chance of getting AIDS through vaginal contact was 50% per sex act. So basically, after 3 acts of sex between a man and a woman, if one or the other had HIV, the other would get it. And that's insane. It's probably on the order of thousands of acts of intercourse, thousands. So Redfield was spectacularly wrong. Fauci was spectacularly wrong. Fauci is now one of the two top infectious disease people in the country, and Redfield is the other one. It pays to be spectacularly wrong if you're wrong in the right direction. So my point of bringing all this up is the bad guys, as I put it, public health people, the media, they learn from AIDS that you can not just get away with this, but spectacularly so. So we have seen it time and again since. We saw it with avian flu that was supposed to kill millions and millions of people. It killed 400. We saw it with SARS that was supposed to kill millions and millions of people. It killed 744. We saw it with mad cow disease that a guy named Neil Ferguson said would kill as many as 50,000 people. It killed a couple of hundred. Neil Ferguson also weighed in on avian flu, a couple million there. Again, it killed about 400 people. Yeah, that's the same Neil Ferguson that came up with the model saying as many as 2.2 million American deaths from COVID-19. Neil Ferguson personally learned that the more outrageous you are, the more wrong you are, the more you are rewarded. All of these people have been taught. Ebola 1, Ebola 2, Zika virus. I wrote about all of these things. I was right, they were wrong. Look where I am, look where they are. Each and every faux epidemic, each and every faux disaster, these people learned we can get away with this.
Well, and also, aren't doctors in general just kind of predisposed to give you worst case scenario? And that's kind of what they're doing. They want to err on the side of worst case scenario because, you know, if you underestimated something, now you're really head's on a chopping block. But if you overestimated it, you know, we erred on the side of extra caution, everybody's going to cut you some slack. Well, okay, thank God it didn't turn out to be that bad, but we erred on the side of caution.
Plus, there's the additional factor of, you always see this, they say the only reason it didn't turn out to be apocalyptic like we said it would be is because we said it would be apocalyptic. Because people listened to us and they took the proper actions. And that's never been the case. What incredible things did we do to fight Ebola? Nothing really. Ebola was always an African disease. It was always slated to remain an African disease. A few cases came by airplane to other countries, and nobody got infected from those few cases. SARS was always had a high lethality rate, was very, very hard to spread, just on and on and on. I personally wrote at the time, these things are exaggerated, these predictions are false. I didn't write in hindsight. I was right, they were all wrong. How is it that Mike Fumento, with no formal epidemiological training, no formal virological training or anything like that, how was it I was right and they were all wrong with their degrees and their positions and what have you? And it really comes down to, a couple of things. I hate being wrong. It just, it's an OCD thing. It just drives me nuts. I will put in any amount of research to not be wrong. But another thing is, I want to be right. I want to tell people the truth, whatever it happens to be. They don't want to be right. They don't want to tell people the truth, whatever it happens to be. They want to exaggerate.
And isn't the other parallel to AIDS that just as with AIDS, they wanted to make it appear that anyone can get this? With coronavirus, it appears very clear it affects the elderly and people with serious pre-existing health conditions, but they don't want people to think that, oh, no, this is just an elderly thing. It's just people with health conditions. And so they exaggerate how much it affects your average healthy person.
Right. You see it in the slogans like we're all in this together. It's just like AIDS. AIDS doesn't discriminate. For COVID, it's we're all in this together. No, we're not all in this together. Almost nobody in the United States under age 20 has died of COVID. Under age 20, you are less likely to get the disease. You are less likely to spread the disease. A lot of people don't know that. And you're much less likely to die of the disease. Almost no chance of dying of COVID if you're under 20. For that matter, if you're under 30, there's almost no chance of dying of the disease. It's basically, by the time you get to 60, 65, 75, 80, that's when your risks start to get real. And even there, as you pointed out, almost all of these people have pre-existing conditions. Diabetes, heart disease, asthma, things like that. The CDC, this is also a new CDC study, has found that 93% of all COVID deaths in the United States, those people had at least one pre-existing condition. and often 2, 3, or even more.